Welcome. You are at the Making Sense of COVID-19 Vaccine webinar this morning. It's a conjunction project with the Immigrant Service Providers Network, which is called the ISPN, and RRT, the Regional Response Team, and PrepareSTL. We are so glad to be able to do this together. I just wanted to tell you a few quick things before we get started. First of all, I'm Meredith Rata, and I am with St. Francis Community Services. But my role here is as the committee chair for the ISPN COVID vaccine committee. I wanted to tell you before we get started, actually, too, just so you know, we cannot see you. You can only see us. So the only way that you'll be able to talk to us is using the Q&A panel below. So hopefully you've all participated in that before, in a webinar before, and you know how to use that. But feel free to enter questions as we go, and we will respond to those potentially throughout the presentation. And then we will also have a Q&A session at the end. I just wanted to tell you a little bit about the ISPN in case you are not familiar. I'm assuming that most of you, that's why you're here, is because you're already connected with the ISPN. But you know, we are a group of over 40 providers in the St. Louis area that work with the immigrant community, and we come together on a monthly basis to collaborate. And you are welcome to those meetings. They are typically the fourth Wednesday of the month in the mornings, and you should definitely sign up for our weekly roundup. And if you would like more information about that, we can get that to you towards the end. We'll drop some links in, I believe, in the chat, and let you know how to access that. I also wanted to let you know that so our COVID vaccine committee has been working together. So we're working kind of in two different platforms or two different areas. One is working on getting information, correct information, accurate information into the academic community about vaccines. I think we all know that accurate information it takes a lot of work to try to find it amidst some of the misinformation for all of us. And so I know that's why you're here. I know that you are trusted partners in the community. People come to you and probably expect you to have a lot of good information. And I don't know about you, but sometimes I'm not a doctor and I struggle, right? And I've had some questions. And so we decided to invite some doctors to help us understand a little bit more about vaccines and how we can talk to our clients about the vaccines. So, and also, we also wanted to give the RRT some time to help us understand a little bit more about some of the resources that they can offer us in helping communicate with our clients about correct information so that our clients can make the right choice for them about vaccine. So with all that being said, I would like to now introduce Serena Mohammed of the RRT, and she's gonna tell us a little bit more about what they're doing.
Okay, thanks, Meredith. And we are very excited to be able to partner on this panel. So the Regional Response Team is partnering with PrepareSTL to do a joint vaccine education campaign. And our primary purpose is to make sure that we can support people in making the choice that is best for them and their loved ones. So we're very clear that we're not telling people what to do. People have their own agency, and we trust that with good information, they will make decisions that are best for them. We also want to make sure that we create a space where we can listen to what is happening in community and be responsive. So the Regional Response Team creates materials, frequently asked questions pages. We have a website where we're trying to curate information about the COVID-19 vaccine that organizations might find useful. So panels like this help us understand what some of the questions are in the community so that we can continue to generate content, whether it's flyers or additional presentations to answer some of those questions. So we consider this to be the beginning of a conversation, and we welcome additional questions and feedback as we go. And we would like to be a resource to make sure that you have what you need as an organization to serve the communities that you serve. In addition to the panels, we also have a component called Community Health Champions that's being spearheaded by PrepareSTL. And the model that we're using is peer-to-peer education. We understand that even with expertise, if you don't have relationship, it's not always easy to get a message across. So in addition to having our expert panels, we also convene smaller conversations that are peer-to-peer, where individuals can talk to their network about the vaccine. And in that setting, we provide support from a vaccine expert, as well as someone to support the technology needed to host the Zoom conversation. And the purpose of that is that we believe that people are comfortable talking to people that they know and could have better, more enriching conversations within their own circle or networks. So we're in the process of recruiting community health champions. If you have individuals that you work with or in your organization that would be interested in hosting some of those conversations, then that's another partnership opportunity that we would like to explore with this group. Every community health champion receives $200 per conversation, and I may be getting that wrong, so I'm going to put the exact amount in the chat. But the point is that we're trying to pay people for their time, and we're asking each person to have a conversation with 10 people and to have at least 2 conversations. And again, the person can have the conversation in their native language as long as they're able to interface with our infectious disease experts who are English speaking. So the person needs to be bilingual, with English being one of those languages. In addition to the community health champions, we also have a speakers bureau that we can make available to groups. If you already have a standing meeting or something with your organization and you want someone to come in and answer specific questions, then we can schedule those as well. The community health champions is more community focused. The speakers bureau is more organizationally focused. So those are our resources, and we look forward to seeing how we can continue to partner with the ISPN. So I will turn it back over to Meredith.
Thank you, Serena. Let's see if we can, I appreciate that. I think for all of you who are joining us, you can stay tuned for more information about how to access those resources. I think you've probably seen some of them listed in our ISPN roundup, but we will make sure that that information goes out again so that you can know how to access that. Those are great resources, I think, and I'd like to see all of us take advantage of those. So just so you know, what's going to happen next is we have a panel of 3 doctors who are going to talk to us for about 20 minutes. And then we have allotted a full 25 minutes for Q&A so that you can think about questions that you have personally, questions that you have, you know that you have clients or other people coming to you and asking you, and you're like, I don't know how to answer that, or like, what's the best way to approach that? So I fully encourage you to interact with this panel. They are wonderful experts, and I'm going to introduce them now. We have Dr. LJ Punch, who is a trauma surgeon, founder of the T and community health advocate. We have Dr. Stephen Liang, who is an infectious disease specialist and emergency physician at Washington University School of Medicine, Barnes-Jewish Hospital. And we also have Dr. Osama Altayar, who joined Washington University Department of Medicine in the Division of Gastroenterology in 2019, and he earned his medical degree from the Faculty of Medicine at Damascus University in Syria. We are really thrilled to have these 3. I think to me, they're actually becoming like minor celebrities in St. Louis because I see them everywhere because their expertise is so valuable. So let's start with Dr. Punch.
Hi, thank you so much for the invitation to share. And it is a pleasure to be sharing this opportunity with friends. The little tidbit, Dr. Liang and I went to medicals. We did residency together, so there's a connection beyond even St. Louis. I'm going to be sharing my screen and sharing some slides about how I'm thinking about talking to communities about living in this second year of COVID, especially now that a vaccination option is available. And the center of this conversation for me has really been around informed choice, and that has been the way that PrepareSTL has been thinking about sharing this information. And here's why. So first of all, SARS-CoV-2, the novel coronavirus, has presented our bodies, right, with a unique challenge to our humanity, our health, and our immune system in a way that really the human population has not been exposed to before. And unfortunately, that challenge is not simply going to end. It has changed the way we do life on a day-to-day basis. And it really requires us to think about what it means to be well and healthy in a whole new way in order to survive really and thrive on this planet with this virus around. How we make our decisions about the way we'll interact with medical support is deeply, and I guess should be deeply influenced by the medical ethic of autonomy, which means that healthcare systems, healthcare structures, and public health systems owe it to people to support them to be able to make choices about their body, which are informed. And that is the core of informed choice. Amazingly, when we allow people to think about what matters to them in terms of risks and benefits, they have power in their own decision making. And that power does a couple things. One, I think it makes them much more confident about the decision they do make and able to tolerate whatever happens because of the decision they made. And it also really helps lessen the impact of the ways that people might feel distant from medical care and the medical community. The bottom line is the best choice is an informed choice, and we want to support that in every way possible. You know, first of all, let's dig into COVID a little bit more. I mean, SARS-CoV-2 has caused COVID-19. You get an infection and the infection shows up in you as a disease. Some people will have a disease which creates no symptoms at all, and some people have lost their lives. It spreads through the air and is extremely good at causing infections by contacting our nose, lungs, even through the lining of our intestines and eyes. And it takes advantage of all the places we come in contact with other people, the things that create the fiber of our social life, and really what then fuels our health. It challenges and suppresses our immune system. So when you get a COVID-19 disease process going on inside your body, it actively goes at your immune system and it causes a disease that for some, for many, can last for months and months and months, even after mild infection. It has disproportionately impacted the lives of people of color in our region, in this country, and in the world. And for that reason, it really creates a very unique and ongoing challenge. So how do we support people to make an informed choice about their immune health in the midst of all the information about vaccination and otherwise? Well, I think we start first by recognizing that if people are concerned about the safety of the vaccine or the way in which the community they represent might be unfairly treated when it comes to the vaccine, we have to recognize that all of that comes from a real body of medical trauma. And we're not trying to coerce people into a particular choice. Again, we want to support them to make an informed choice. And here's a choice, right, that nobody has to disagree about. And that's the impact of having the right information and knowing how to support your immune health no matter what. What are the things that go into immune health? What we eat. This is one of the core issues around providing your body with the nutrients it needs, both the calories, the protein, and the other supplements to make sure we have a strong immune system. Making sure we have rest, because in rest and in sleep is when our body does a lot of immune work. Vitamins that create supplements like vitamin C, zinc, and vitamin D, those three in particular are really important to having a strong immune system. Staying hydrated so that all our organs get the blood flow that they need. Doing your best to manage the way stress is showing up in your life and in your body. Because when you stay chronically stressed with high levels of stress hormones, you literally shut down and turn down your immune system. And then being careful to keep hygiene, again, things like clean hands and a clean body. If you have chronic health conditions, doing your best to manage those all help. All of that is stuff that anybody can do, regardless of their thought about the vaccine. And I find this to be a very powerful first place to start when talking to people about informed choice, because it's something we can all agree about. There is no replacement for ongoing physical distance covering and again, hygiene, because the truth is you won't get the disease if you don't get the infection. If the infection is prevented by a physical barrier, then again, that's something we can all agree on. This is how we can support an informed choice. So how do people, once they're in the midst of making an informed choice, think about their personal considerations? Because after we lay down this foundation about what we can all agree about, then it goes to the individual and them being able to say, here are my risks, here's what I think the benefit is, and here's how the math kind of works out for me. So first of all, exposures to COVID-19. There are some for whom getting exposed to COVID-19 is inevitable. Like there's nothing, they can't not have it because, for instance, they're healthcare professionals, they're working in a healthcare environment or an assisted living or some other institution where they're getting exposed to people. That can happen again in the workplace and it can happen in home. Thinking about how much you can continue to stay at a distance versus the way that you can avoid getting exposed is really important. This is becoming important again in our region, right? Because across the country, unfortunately, COVID-19 numbers are once again going in the wrong direction. If you have health concerns, chronic things like diabetes, lung disease, heart disease, cancer, these particular concerns make you more at risk for your own health. And if you live with someone who has these kinds of health concerns, you're more likely to get severe COVID, and severe COVID can cause life to come to an end. And so these are the kinds of things you need to think about. Now, can you keep a distance? If you really, really have strong feelings about, for instance, not getting the vaccine, what's the degree to which you can commit to not being in places where COVID is occurring? Some people just don't have that choice. And again, risk and benefit changes there. And then really want to focus on immune health at baseline. If people have an under or overactive immune system, if they have a history of really bad allergic reactions, not allergies, allergic reactions, like they have to carry an epinephrine pen, or they know their face swells up if they have one peanut, or if there's scallops, or they have had a reaction to the flu vaccine before. Any of those kinds of things, that's a unique health concern. And again, prior reaction to vaccination. For this group of folks, I highly suggest a conversation with a physician one-on-one about their unique risks and benefits around the vaccine. That's the best advice that I can give. Pregnancy is interesting because people who are pregnant have a lower immune system, and there are unique risks to the baby as well. I think everyone needs, again, to have that added level of concern around their risks and benefits if they have one of these immune health concerns. So in the end, healthy communities will have healthy immune systems, and everyone has access to tools to support their immune system. Making the decision about vaccination or not is a risk and benefit conversation that people can have with themselves if they have the information, because with the right information, informed choice will give them power in the situation in which they might have felt powerless in the past. So our job is to make that access to information equitable so that people can make an informed decision based on what matters to them most. With that, I'm happy to take questions, and thank you for allowing me to share.
Let's see. So yeah, actually, I was gonna say right now, I think it'd be great to have Dr. Liang continue, and then we'll keep collecting questions as we go.
Good morning. It's a real privilege to be here with colleagues, Dr. Punch, as well as Dr. Altayar, to be able to share some of this information. Obviously, one of the things that is most important to us is that the public understand the data and the science that goes behind these vaccines, and why there's a lot of enthusiasm, a lot of interest in getting the vaccines rolled out. With that, I want to kind of go through an overview. So as far as the vaccines, A lot of work has happened in the last year or so, and this is a reflection of a lot of money, a lot of attention on the part of our vaccine developers, as well as the public in terms of fielding several vaccines that have now reached the stage 3 or phase 3 stage of things and have now been emergency use authorized for the public's use. So you'll see here, and when we talk about clinical trials and vaccines, they go stepwise in terms of first studying the safety of the vaccine in phase 1, then smaller studies looking at, again, safety and efficacy, the effectiveness of a vaccine at phase 2, and then finally large scale phase 3 studies where they involve tens of thousands of participants to look at effectiveness as well as safety. As far as the United States, there are 3 emergency use authorized vaccines which you probably have heard of. So I'm going to go by their trade names because the other names for these vaccines are very difficult to refer to, but I'll talk about the Pfizer, the Moderna, and the Janssen or Johnson & Johnson vaccine. As you know, the Pfizer and the Moderna vaccines are 2 vaccine doses, and the Johnson & Johnson or Janssen vaccine is only 1 dose. And each of them has their own pluses and minuses. So a quick word about the Moderna and Pfizer vaccines. These are mRNA vaccines, and you've probably heard a little bit about this in the press. And very simply, what this is, these vaccines basically will work on the spike protein. So this purple spike protein on the surface of the virus is what allows the SARS-CoV-2 virus to attach to cells within our lungs and cause infection. So the premise here is that we basically develop a blueprint for that spike protein. We place that in a vaccine, which is then injected in the arm of a human being, and that then is presented to a human being's immune system. So the immune system sees that spike protein and starts developing antibodies. That's our body's defense against infection. Once we have those antibodies, they will protect us against future exposure. So if our body ever sees that virus again, it recognizes that spike protein and knows exactly what to do in terms of protecting us. So a quick word, I know a lot of this is very science heavy, but I think that hopefully some of these graphs will basically be able to speak a million words to you. But as far as the Pfizer vaccine, this was studied in a large phase 3 trial that involved more than 40,000 participants. And I've kind of circled the participants and the breakdown of those involved. And you'll see that as far as communities of color, we have roughly about a 30% percentage of that study population coming from African American, Asian, as well as Hispanic backgrounds. This study was done predominantly in the United States, with also involvement from South Africa and Latin America with Brazil and Argentina. And this is really the kind of the figure that really knocked our socks off back in December when this vaccine was first authorized. What you'll see here on this axis here, so on the vertical axis, that is the number of new cases of COVID-19 within the 2 populations. And then on a horizontal axis is the number of days after the vaccine was received by participants. And you'll see very quickly that those who received the vaccine in red versus those who received the placebo, so no vaccine in blue, you'll see very quickly that they diverged in the number of cases in both populations. And the vaccine was clearly protective to those who received that vaccine. 95% efficacy is what has been quoted for the Pfizer vaccine, so extremely high. When you think about flu vaccines, usually the efficacy is around 60% if we're lucky, 60 to 70%. So this one was extremely, really panned out very well. As far as the safety profile, we know that some folks will have kind of mild pain at the injection site. Some people have reported chills, aches, kind of flu-like syndrome within the first 1 to 2 days afterwards, but that very quickly resolves. And then very small percentage of people within this study had a serious allergic reaction, about 0.5%. This vaccine has also now been distributed worldwide, and some of our most promising data comes from Israel, where they have now reached a percentage of vaccination in the 60 or 70% from the last time I heard. What you see here is that within this post-surveillance study, more than 1 million participants within several large health systems received the vaccine. And again, you'll recognize these curves here, those who were vaccinated in blue, those who were not vaccinated in red. And basically, there was a significant reduction in the number of cases of infection, serious infection that resulted in people ending up in a hospital. And certainly there were, as far as a number of deaths related to COVID-19, there was a major, major difference between these 2 groups. And this is very consistent with our Pfizer data. Moving on to the other mRNA vaccine, we have the Moderna vaccine, which has also been studied in a similar large-scale trial. Very quickly, as far as a breakdown of that study, probably about 15% communities of color. And again, 93 to 94% efficacy was found with this study, with this vaccine as well. And you'll probably pick up the theme that you'll see with many of these figures, is that those who are vaccinated are significantly protected against severe disease with COVID-19. Side effects are similar to Pfizer as far as injection site pain, and then also the aches and chills afterwards in some cases. As far as safety, so we know that both vaccines with Pfizer and Moderna, now we have a lot of experience here in the United States. Among several million doses, the number of cases of severe allergic reaction or anaphylaxis, so this is severe enough to cause breathing problems, is in the double digits. So we're talking about 10 to 20 events within several million doses. So an extremely, extremely uncommon event. In most cases, this has involved folks who have had prior allergic reactions related to vaccines. And so that's why it's really important to have a conversation with your primary care physician about whether or not you might be at risk for this type of side effect if you've had prior vaccine troubles in the past. We also now know that the mRNA vaccines, the Pfizer and the Moderna vaccines, do protect against infection. This is not well studied back in December, but we now have data from several large sites in the United States that show where they basically tested people who got vaccine every week afterwards to see if they got infected with SARS-CoV-2 or COVID-19. And very quickly, as far as the vaccine effectiveness against infection itself, 80% to 90%. So those who got vaccinated were significantly protected against infection, period. Very quickly, this is the other vaccine type that we're going to talk about, the Johnson & Johnson vaccine. This is a viral vector vaccine. And in this case, what is done is, again, they're focusing on that spike protein that attaches to the lung cell. They're making a copy of the blueprint that makes that spike protein. They put it in a virus. That virus is then injected into the human's arm. And again, this presents to the immune system and a reaction is generated for antibodies. So the immune system is again primed with exposure to that spike protein and can now develop antibodies for future protection against SARS-CoV-2. This is the Johnson & Johnson study. Again, similar. You'll see here as far as a breakdown of population, roughly about 20 to 30% communities of color. Very large study, more than 40,000 participants. And you'll see that the vaccine and placebo groups also diverge very quickly within the first 2 weeks or so. You start seeing differences in terms of the number of people who get infected. Now, it has been quoted in the literature here, as well as in the press, that this is a 66% efficacy was found within the study. However, these studies were done in different countries at different times of the pandemic. And in this case, this particular study was done in several countries where they were having extremely high numbers of cases of COVID-19. They were also seeing issues with variants, which we may talk about a little bit later on, which could probably resulted in kind of a little bit lower efficacy than we would have expected. When they controlled for countries in the United States, it was 72% effective. As far as the safety profile, very similar, pain in the arm. Some cases, people might have some non-specific muscle aches and headache afterwards, and serious side effects are very rare again. So the goal with all vaccines, you may have heard of this term, herd immunity. And basically, very simply, what this idea is that if we vaccinate enough people, so in this case, in red, no one is vaccinated, so everyone has a risk for infection. If we vaccinate enough people here in blue and we spread them out, the thought is that we can now kind of prevent transmission in large populations of this virus. Some unanswered questions very quickly. There's still a lot we're learning about these vaccines. They've only been out for a couple months. So as far as how long the vaccine provides protection, that is yet to be known, but we do feel like these vaccines do a really good job of generating immune response to this virus. As far as the long-term safety data, they'll continue to monitor that. I'm not going to go too much further into any of these other ones. And as Dr. Punch has mentioned before, vaccines are truly a personal choice. Our goal here is to provide information for you and your clients to make informed choice based on the data and the science, and also to combat misinformation, misconceptions about the vaccine. We're still learning a lot about these vaccines and the variants and how effective they are, but a lot of the data is very promising. And our goal at the end of the day is to provide both equitable and efficient vaccine distribution. Very quickly, you probably have seen this as far as the availability of vaccines in the state of Missouri. Currently, we are moving towards phase 3, and that's great news. So in April, on April 9th, 2021, it's anticipated that all Missouri residents will have access, will be eligible for vaccines. So with that, I'm happy to pass the baton over to Dr. Altayar to continue. Thank you.
Thank you for having me today. It's an honor to present to you today with Dr. Punch and Dr. Liang. So I'm really going to talk about, I'm going to use my background being from Syria originally and living in different Arabic countries, just to mention a few things related to things that we don't see here, things that on other news networks or social media that we don't have access to. And these are things that could affect, I know we're talking about refugees, and I know that we have a relatively large Syrian Iraqi community. So I was thinking that this could be helpful in understanding not only the Syrian Iraqi community, but even other communities. So this is the first one that I want to talk to you about is actually local news networks. This is actually, you will see a lot of the slides that I'm going to present, they will have things presented in Arabic. And I'm intentionally leaving this in Arabic just to know that, this is what our people are reading and we don't read frequently. So this is from the Syrian News Network. This is the government news network. And they have actually a video on their website about how physicians are avoiding the vaccine, for example, and how physicians are afraid of the vaccine, how it may change, how there are concerns about changing the DNA, and many of the questions that were already raised. This is another post from their website also talking about how frequent the side effects are. This is actually was just published a few days ago on March 25th, and how in South Korea, there's a lot of concerns about side effects and all this. And a lot of these things sometimes are related to, political agendas or something like that, in terms of, so for example, in Syria, there's currently no vaccine. So a lot of people are afraid of doing vaccines because of all these news that are being presented by the government even. The other thing that is pretty common is WhatsApp messages. And I get a lot of those, from family members, friends who live overseas, and they reach out to me asking me questions and share these posts with me. This is an example from a commercial leader. So this is a person who has a lot of companies. He's an industrialist in the Middle East, and people listen to him frequently. And this person, for example, said that in a few months there'll be a catastrophe with the vaccination. And a lot of people listen to this person, for example, has a lot of followers. And this was being shared on WhatsApp. Other questions that kept coming on WhatsApp, well, that COVID-19 vaccination, for example, will lead to getting in COVID-19 infection. The COVID-19 infection, I saw this was as one of the questions, that it will affect the DNA. That there's no benefit of the COVID-19, that if you get the COVID-19, you don't need the mask. That there are concerns about the side effects, long-term side effects of the vaccine. These are things that are being shared, and each one of those, this is just the beginning of the message. There are long lines talking about all these concerns, and people are getting afraid of the vaccines, essentially getting maybe likely misinformed in these cases. The other source that we usually, Twitter has been doing a good job in terms of monitoring misinformation or misleading information and flagging them, but this is only in English. For example, in Arabic, there are all these posts that I'm going to share a few of them that are not flagged by Twitter because they're in Arabic. So this is somebody has about 30,000 followers talking about how Bill Gates is behind the vaccines and how it's going to lead to infertility, and that's intentional for infertility to decrease the population on Earth, for example. This is another post from somebody who has, I think, 12,000 followers, and that person is sharing something in English, just translating in Arabic the way they want, and saying that how there are thousands of deaths in Israel, despite having, being one of the countries that vaccinated the most. This is another one talking about how the animal trials were skipped in vaccinations, which is not the traditional practice in trials, and how this is concerning, and they're sharing a video in English. Usually these videos come with Arabic translation that is not accurate even. This is another one, for example, showing numerous faces saying that how these people, who think that the Earth are overpopulated are advocating for vaccine. You can see the face of Dr. Fauci here and criticizing these things. This is another one saying this is actually a different theme here, where this is actually a professor or somebody who, I don't know if he is or he's not, or she's not, a professor in immunology at a university, and saying that he or she has the treatment for COVID-19, and there's no need for the vaccine at all, and he has 100% success, and citing all the protocol that they're using. Another one here talking about infertility, also sharing a video on how it could cause infertility. Another one on how it could cause breast cancer or cause symptoms of breast cancer. Another one on how the vaccine is not going to be helpful because of the mutations that are happening, and that actually everything is going to get better without the vaccine because of herd immunity, for example. So I also wanted to share with you a few resources and some limitations that you may encounter when you use these resources. These are, I think, reliable resources. I reviewed all of them myself. The Saudi government has been doing an excellent job sharing information in Arabic. So they have actually a PDF file that I could show you also. They have a whole website where they are sharing information about the COVID vaccine and awareness about COVID. They have a lot of PDF files that you could print and share with people. Now, when you do this, you have to keep in mind some political sensitivities. People in the Middle East where they don't like, in some countries, for example, that don't like Saudi Arabia, some countries that are okay with Saudi Arabia. So there are some political sensitivities that may arise from this. Mayo Clinic also has something in Arabic actually on their website about the vaccines. The New York city government also has something on the vaccines that's also very informative. Also, finally, the UNICEF has a long document on the vaccines in Arabic. So there are resources in Arabic that could be used and shared if you're dealing with patients who are from different cultures, at least in Arabic, to the best of my knowledge here. The other thing that you should keep in mind when you're dealing with at least refugees from Arabic countries where there's a majority of Muslims, that the month of Ramadan is coming soon, and it's starting on April 13. So a lot of people in Ramadan, people fast from sunrise to sunset, no drinking, no eating. But there's a lot of concerns always about anything medical, like, for example, vaccinations that could invalidate the fasting. This is also a resource that you could share with people, for example, on, well, how, by different religious leaders from different countries, also because there's also politics involved in this, on how it should not affect the fasting, for example. But these are things that need to be kept in mind, that people are getting information from other sources, from where they came from their countries or from their family overseas, that might be working against providing accurate information, and that's happening frequently now. Some, as I shared with you, some governments, some resources are trying to contradict that, but these are the sources that are shared between common people mostly. That's all I have.
That was wonderful. Thank you. Especially with the cultural considerations that are really applicable to a lot of the people that are listening today. We have a variety of questions for the panel. So I'm going to toss them out and let you all decide who can answer them if that works. I'm going to be selfish and ask one that I've heard a lot among a lot of different people that maybe wasn't proposed or wasn't put out here in the Q&A, but so there's 3 different vaccines, there's 3 different percentages, of like efficacy. how do we talk about that with our friends, our family, our clients? I mean, you know, like, should I get what vaccine? That kind of thing. What answers do you have for us?
I'm happy to tackle that if you like. So yes, there are 3 different vaccines and 3 different studies. And the challenge here is that it's very difficult to compare these vaccines against each other. So they were studied against a placebo. They were studied at different times of the year in different countries and different populations at different times when in terms of the pandemic, as far as number of cases and transmission and so forth. So those numbers are very difficult to compare against each other. What is needed is a trial where they compare the vaccines head to head in one place. And that is actually being done from what I understand. We just don't have those results. My best advice, I think all of our best advice is that if you do choose that you want to pursue a vaccine, that you know, any of these 3 vaccines is perfectly fine and will provide protection. We know that the vaccines protect against severe COVID-19. Now we know that it prevents against infection with COVID-19 in many instances as well.
Thank you. Actually, could you, Dr. Liang, can you clarify that what the last sentence? I think I was trying to grasp that during your presentation. What are those 2 different distinctions? It prevents against what and what?
Good. Yep, absolutely. So the way the studies were done is that they, because of the way they were done, they were looking for severe disease that landed people in the hospital or requiring the ICU, ending up on a ventilator or so forth. So bad enough COVID-19 that you could actually potentially die from it. That's what they studied as far as their endpoint and the protection. It's so from that standpoint, the effectiveness of vaccines is very high. They did not look specifically at whether or not someone could be asymptomatically infected, because that's a very difficult study to do in a clinical trial of that number. But we are seeing now in the kind of the post-vaccination phase that many people, with some of the studies that are being done, they're actually looking for active asymptomatic infection, and they're not finding it a whole lot in those who have received the vaccine. So those who are vaccinated will probably, in many instances, be very extremely well protected against the virus even causing any kind of infection, an asymptomatic infection without symptoms.
I just want to break that down a little bit because I typed an answer in the chat, and I think it's really important. The vaccine is about people dying. COVID-19 in its severe form, and I worked in the ICU for the past year, taking care of critically ill patients who were dying of COVID. I saw more people die from COVID than what I saw in a lot of other disease processes. And the vaccine in the studies, depending on what study, and the studies aren't perfect, protected 7 to 9 out of every 10 people from getting that severe disease. That's what the point is. The point is that with the vaccine, we won't have so many people dying. There are still so many unanswered questions, although it sounds like the energy is moving in a favorable direction, but still many unanswered questions about the infection, because the infection is the mechanical reality of the virus being in your body. The disease is a consequence of your immune response to that infection. That's why immune health is important no matter what. And so here's my only caution. My worry, and something that I think could hurt vulnerable communities very much, is that someone will be vaccinated and believe that they have no ability to hurt or infect or do anything to anybody around them. And then they end up being the reason why an immune compromised, vulnerable, elderly, chronically ill family member gets sick. I know I struggled with that immensely in my own decision making, not wanting to be the reason why my mother got COVID. And I think the best sort of posture to take for right now, especially with variants on the rise, especially with numbers on the rise, is to continue, as hard as it is, I know, I know it's hard, to be cautious and use all those same physical barriers to prevent the infection in the first place. Will we get somewhere else? Maybe even soon. I hope so. I want it to be that way. But I think that if we're going to serve our communities, we need to give them the safest advice, which is to continue to mask and keep distance, which brings up a really great question that I see in the open questions, which is, listen, what about a family, right, that lives a large group of people in one space? There's no way they can distance inside the home. And the question I would say back to that family is, inside the home, you are sharing space. You can't avoid that. The question is, what contacts are you having outside the home? And if a family member is having high risk, to bring that word back in, high risk contact, then their behavior, right, and their contacts and their exposures are putting their entire family bubble, right, at risk. And so they need to think very carefully, right, about what they're doing to support themselves as much as possible with their immune health and the decision of whether or not to get the vaccine. So the question for that family is not necessarily what's happening inside the home. It's what are people bringing into the home from the outside, and they need to think together about that risk. And if there's somebody who's having high risk contact outside of the home, then it's really, really important for them to be even more vigilant about preventing infection.
Thank you for that context. It's really hard to hear that we have to be patient and still careful. I'll be honest. But I think it's a really important message. And if we can all be on the same page with that, I think one of the other things I was just reflecting on while you're talking about that was like a lot of the immigrant populations we work with are from collective cultures, and so like doing something that's for the good of everyone is actually like really natural, right? And it really makes sense, and it's actually very different than some of the cultural values that the people that were born in the United States have. So it's not as hard of a sell, to like let's think about like what works for everyone, which is kind of something we can use to our advantage when we talk to clients. Let me ask a few questions that were also asked in the chat or in the Q&A. How do we respond to a lot of this misinformation about, for example, RNA will change DNA, that the vaccine process was done really quickly, too quickly, right? It was, what was it called? Operation Warp Speed. We don't know, well, it's only been around for however long. Maybe we don't know about latent effects. How do you all approach those questions?
I would say that, so the technology for the vaccine itself, this mRNA vaccine, that technology has been around for a couple of years and has been used with other viruses. We were just really lucky that this technology was on the shelf and that very quickly the scientists last January were able to get the whole sequence of the virus and start working on a vaccine. That being said, I mean, it was very fast, and part of the reason why it was so fast is because so many resources were put into it. They were able to recruit a lot of people in these studies. Usually it takes years to get the numbers of participants to participate in a large study like this. As far as the concern about the RNA mixing with our own RNA and DNA and so forth, we know that the RNA in the vaccine very quickly degrades. It gives our cells the kind of the quick snapshot of what the virus, that the piece of the virus looks like, so it can build the antibodies and then it disappears. So there is no concern that the RNA is going to kind of combine with any of our molecular and of our genetic material. You are right that we only have had these vaccines for a couple months now, and that we're still going to continue to learn a lot more about them. But now we have millions of participants and now members of the public who've been vaccinated, and it's shown to have been very safe so far.
I just want to add another point to how fast the vaccine was developed, because this is a question that I get frequently also. So I think one thing that we have to emphasize always is how technology has changed. For example, let's say 20 years ago, if you wanted to make a vaccine, you need the bacteria or the virus itself, and you need to transport it from China to the US in a safe way and then produce all these things. While now all what was needed is the genetic code of the virus, then the scientists were able to produce a protein from that genetic sequence. All these are technologies evolved over the past 20 years or so that allowed us to do this so quickly. So previously that was not possible because we didn't have those technology. We could not produce the protein from the genetic sequence. We could not transport get the genetic sequence itself. So all these things that led to the vaccine being developed quickly compared to some people are using HIV as an example why we don't have HIV vaccine yet. Some people are using other infections that we had for years and we couldn't develop vaccine until late in time. But that's because of how science has developed, and these things have been developing in parallel ways. So each one of these technologies has been developing in a parallel way. They are not like sequential development. So the use of deciphering the genetic sequence has developed independently of being able to produce the proteins from genetic sequence. So, and that's why we were able to do this so quickly.
Thank you. I know a lot of the questions that people have are about like information and how we can share that, and even like accessing vaccine. And to be like perfectly frank, I'm not sure if that's where your all's expertise is or not. But like one of the questions that we've gotten before the session, and I don't know if you can answer this, is especially in approaching undocumented individuals, can we ensure them that like the federal officials won't go back on their word to not share any of that information with law enforcement or anybody else? Do you all have any insight into that? Or is that like better directed towards the people who are actually collecting that information when we get vaccinated?
I think I will say something, hopefully it's related, but usually in the hospital settings, when we treat somebody who has any law problems, or like an immigrant, they said, or an undocumented immigrant or somebody, that has nothing to do with, with the medical care. The medical care will happen regardless of anything else. We see people who have other problems that we don't disclose and all this because the goal is really to take care of the patient, not anything else. That's our job. I don't know if Dr. Punch and Dr. Liang has more information about the vaccine process.
Unfortunately, I don't have any specific information about what it was collected and how it's reported. Probably a better question we can reach to some of our partners.
Yeah, thank you. That makes sense. I know that, for example, St. Louis County was asking a wording about how to make it clear that they were not going to, in any circumstance, unless actually compelled to turn over information, they would not turn over information. I think it's really hard for us to all think together about how we message that, because we've been through some rough times and understand that sometimes the government does compel other parts of the government to hand over information. But I think, like with everything, we like to give our clients all the information and then they get to make the choice, right? How about, there's a question over here in the chat about, these are like a little bit more specific, but what can happen if a person receives 2 doses of the vaccine at the same time, or if they get Johnson & Johnson and then they want to get like a second dose, they go back for Moderna? Do you have any like ways to talk about those kinds of issues?
Kind of the best guidance, the uniform guidance has been that you stick with the same vaccine that you received before. So if you got Pfizer, you get the second dose of Pfizer. I mean, it certainly makes the most sense, because with that second dose, you're trying to boost based on your previous experience with the first vaccine. So I think for it to be more effective as it could be, you should get the same one that you got before. If it's Pfizer or Moderna, obviously the Johnson & Johnson's a single dose, so that's what's kind of the beauty of that one.
Okay, we only have about 5 minutes left. Let me ask just a few more that came in from our attendees before we got here. And this is one that I want to know. How long does the protection from a vaccine last?
It's $1 million question here. With these, we've only had these vaccines for going on 3 months now, and the first trials were done last June. So time will tell. I think that most people generate a very robust response to the vaccine. I think the data will kind of bear it out, but I can't put a number on it just yet.
So should we just stay tuned then for more messaging about that? Do you think? I mean, like, or basically,
think
what do we
about-
tell
but-
people that ask
But
us
think
that?
about the science of it, right? So
Yeah.
think about what we already know. Like the whole point is that the vaccine stimulates your immune system to make antibodies, and that part of that process creates a group of cells that remembers that virus. Now, the thing is, the virus can change. The virus has already changed. So if we compare it to something like the flu, because of changes in the virus and the way our immune system works, we generally make a new flu vaccine available every year. Is it possible? Is it possible that COVID could act similarly? Perhaps, and we don't know. The other thing we don't know is how long our cells remember COVID. We don't know how good we are at remembering to react to it. Remember, coronavirus, SARS-CoV-2 is part of the coronavirus family, and that's one of the viruses that causes the common cold, and we're not very good, right, at fighting that. So I'm cautious with this because what I really don't want to have happen is for there to be recommendations that people get booster shots at 1 or 2 years, or that it becomes something we need to think about every year. And then people are like, wait, I thought I was done. I think we need to keep a very open mind, because exactly what Dr. Liang said. First of all, this virus has only been on the planet that we know of, but for so long, right? And we've only had a vaccine to it, but for so long. So we really don't know in the human body how it's all going to work. We need more time to answer that question, but we should be open to the idea that if we want the vaccine to be part of our immune health plan, future vaccines might be necessary.
Thank you for that. It's helpful. It's really helpful to be like, let's take a step back and think about this. I'm noticing we have a lot of questions and we only have 3 minutes left. And I'm trying to figure out who the best person to answer this is. How can we get the rest of these questions answered? Because they're really great. They're very specific, but so many of us don't have a chance to ask them. And so I know we'd love to have very specific answers. Is there a way to keep partnering, or is there somebody we could reach out to?
So I was just going to say, in my opening remarks, I mentioned continuing to send questions. So the regional response team collects all of these questions. We update our frequently asked questions. We schedule other presentations if we see that there's kind of an issue that's bubbling up in different audiences. So we are trying to keep track of what the community wants to know about. So what we've done at the end of our other panels is we've summarized all of the questions, sent them out to the panelists to give them the first opportunity to respond. And then if the panelists don't have responses, then we go throughout our network to find folks who might have the information that you're looking for. So for example, we work with the state of Missouri, and we have some information about the documentation that they're requesting and how they're tracking personal information. So we might be able to answer that question about what goes to the federal government and what's kept locally. But any questions that aren't answered here, we'll do our best to follow up with the group.
That's great. One of the biggest questions we've gotten is, can I get these slides? Can I get this information? And so we're gonna work on being able to share what we can with you all. Right now, we'd love for you all to go to the RRT and PrepareSTL's YouTube for panel clips. And as Serena said, go to their website for more information, and we will send along the information that we have afterwards. I wanted to wrap up, unless there's anything else. Thank you for dropping that stuff in the chat over there for me. I wanted to wrap up, and I'd say a very heartfelt thank you to Dr. Punch, to Dr. Liang, Dr. Altayar, especially to the regional response team. You guys put this together so quickly for us, and we have so many urgent questions, so I really appreciate you being able to respond so quickly. It was it's an honor to work in this space with you, and to continue to think together about how we can all get the community the information we need. I just wanted to remind everyone what Serena just said. There are opportunities to become a community health champion. There are opportunities to engage the Speakers Bureau. And a nice little plug for the ISPN. Next Wednesday at noon, we're going to have a session called Lessons Learned about Vaccination Access. Basically, we're going to put some of our fellow colleagues in on a panel and have them talk about what's worked, what hasn't in terms of helping immigrant clients get connected with vaccines and vaccine events. And then we're going to put you in rooms where you can talk about what's worked for you, and maybe we can crowdsource all that information and then share it. So, because I think we can all learn from each other, right? We are, a lot of us are the experts in what we do, and I want to acknowledge that you all are doing such great work in the community for St. Louis and for ISPN. So thank you all, and we hope to see you back at noon next Wednesday.
Thanks.